Have you ever woken up in the morning with stiff ankles, tight knees, or a lower back that needs a few minutes just to switch on? If you have, you're not alone, and more importantly, it's not because of age. It's simply because our bodies become frozen after hours of sleep. Working with people in their 60s, 70s, and even 80s, I've seen one thing clearly. Most morning discomfort comes from muscles and joints that aren't properly activated the moment we wake up. What's fascinating is this: in Japan, especially in Okinawa, the famous longevity island, older adults can get out of bed, bend, squat, and walk with amazing ease, even at 90 years old. They don't go to the gym. They don't lift weights. They don't do complicated stretches. Their secret? 5 simple morning activation movements. They take less than 20 minutes, but they powerfully improve stability, balance, and reduce stiffness for the whole day. Sparkles, if you're over 60, drop a 1 in the comments. I'll send you the most suitable step-by-step guide. Right after you wake up, when your body is still lying in bed and not yet carrying its full weight, this is the golden moment to take care of your ankles, the balance sensors of your entire body. Many people think stiff ankles are normal when you get older, but in reality, they are one of the main reasons why walking becomes slower, heavier, and more unstable. In Japan, especially among older adults, the Ashikubi undo ankle activation routine is treated like a morning ritual. It wakes up the body's whole sensory system and thins out the joint fluid that becomes thick and sticky after hours of sleep. Start simple. Lie on your back, relax your shoulders and spine. Slowly lift one leg a few centimeters, just enough so your ankle can move freely without straining your thigh. Then, use your hand to gently massage around the ankle. Glide your fingers along both sides of the Achilles tendon. Rotate the soft tissue around the joint, and warm up the whole area. This boosts circulation, wakes up the ligaments, and softens any tightness around the ankle. Once the ankle feels warm, move to the activation phase, ankle circles. Imagine drawing a smooth, wide circle with your toes. Move slowly and with control, 10 circles clockwise, then 10 counterclockwise. Don't rush or force it. You want to feel the joint moving smoothly. If you hear small clicks, that's usually normal. It's just the soft tissues shifting after a long night of being still. What matters is that there's no pain. After the circles, do ankle flex and point. Point your toes downward and hold for 3 seconds. Pull your foot toward your shin and hold for 3 seconds. Repeat 15 times. This is a powerful way to wake up all the lower leg muscles, the flexors, extensors, and the tendons that help them work together. Science shows that these small movements help joint fluid return to a smoother, more liquid state, immediately improving your range of motion. What makes this routine so effective is that it activates the sensory receptors in your feet and ankles, the ones that tell your brain where your body is in space. When those receptors are asleep, your first steps feel shaky and uncertain. Many older adults describe it as, the ground is moving, and just a few minutes of ankle activation each morning dramatically reduces that sensation. Finally, repeat the whole process on the other leg. It only takes a few minutes, but the benefits last all day: lighter steps, stronger balance, and a noticeable boost in confidence. This is why in Japanese senior communities, no one skips a shikubi undo in the morning. It isn't just an exercise, it's a daily dose of vitality for your feet. After waking up your ankles and feeling mobility return to your legs, the next step in the Japanese-style morning activation is to awaken your shoulder blades. This is an area most older adults overlook, yet it directly affects posture, breathing, and the daily discomfort in the neck, shoulders, and upper back. In Japan, this movement is called Kinkokatsu Yoshi, and it's considered the golden key that brings life back to the upper body in the very first minutes of the day. Here's what's important to understand. While you sleep, The upper and mid-back stay almost completely still. Muscles like the rhomboids, middle trapezius, and parts of the serratus anterior, the muscles that hold your shoulders in the right position, go into a deep sleep. When you wake up, your body naturally falls into a slouched posture, shoulders rounding forward, head dropping down, the neck being pulled tight, and your lungs unable to open fully. This is why so many people over 60 feel short of breath, struggle to take a deep inhale, or get neck pain when they turn their head. To fix this, start by sitting at the edge of your bed or on a stable chair. Place both feet firmly on the floor. Keep your spine natural and relaxed. Rest your hands on your thighs and take a slow breath in through your nose. As the air enters your body, gently pull your shoulder blades toward each other, as if you're trying to hold a small pencil between them. Don't push your shoulders down or puff your chest too much. The only thing that should move is the shoulder blades, not the whole shoulder or arms. Hold for 5 seconds, then exhale and release. Repeat this 15 to 20 times, each time a bit deeper and a bit more mindful. The goal isn't to force the movement, it's to feel the shoulder blades sliding toward each other, waking up those tiny but important muscles that have been asleep all night. The benefits of this exercise are well documented by geriatric institutes in Japan and medical programs around the world. When the shoulder blades activate correctly, the chest opens more easily, the lungs fill more completely, and breathing capacity can improve by up to 20%. Re-engaging the upper back muscles also helps relieve tension on the cervical spine, reducing neck and shoulder pain by up to 50% after just a few weeks. But it doesn't stop there. This movement creates a powerful ripple effect for the entire day. Better posture, more confident steps, deeper breathing, and less heaviness around the neck and shoulders. If you notice your shoulders rising toward your ears or your neck getting tight while doing this, don't worry, that's a very common compensation pattern. Just comment, "My neck feels tight," or "My shoulders lift up," and I'll guide you on how to adjust the movement so it becomes effortless and effective. After waking up your legs and restoring mobility to your shoulder blades, the next step in the Japanese-style morning activation is the spinal waves. This movement surprises many people because at first glance, it looks more like a gentle meditative flow than an exercise. But that gentle quality is exactly why spinal waves are one of the most powerful medicines for morning stiffness, spinal mobility, and the deep stabilizing muscles that tend to weaken with age. Start by sitting at the edge of a chair with your feet firmly on the floor. Don't lean on the backrest. Your spine needs the freedom to move. Imagine your spine as a chain of small segments, like a line of dominoes. The goal is for those domino pieces to move one after another instead of shifting as one stiff block, which is very common in older adults. Begin with a small motion from the pelvis. Gently roll your pelvis backward so your lower back rounds slightly. Then tilt your pelvis forward to create a soft curve in your lower spine. Once this movement feels smooth, let the wave travel upward, through the mid-back, upper back, and finally the neck. Slow and steady. Each motion should feel like a small, soft, continuous dance. The most important part isn't how big the movement is, it's being aware of each section of the spine waking up. If your whole back moves at once, don't worry, that's normal. As we age, the deep spinal muscles lose their ability to guide each segment, causing the back to move as a single block. That stiffness or awkwardness you feel is actually a sign that your body needs this movement. The benefits of spinal waves run deep. During the night, fluid pressure inside the discs changes, making them tighter and less smooth. Spinal waves help pump the fluid back into a healthy state, restoring elasticity, like adding oil to a hinge that hasn't opened in a while. People who practice this for just a few minutes each morning often say their back feels lighter, less stiff, and more comfortable when standing, bending, or rotating. Even more important, spinal waves activate deep stabilizing muscles like the multifidus and transverse abdominis, the key muscles that keep your spine steady when you walk, bend, reach, or lift things. Waking them up in the morning reduces the risk of sudden back pain, especially the kind that strikes when the body isn't prepared. Practice spinal waves for 1 to 2 minutes with slow, deep, steady breathing. Within a few days, you'll notice the difference: a softer spine, a warm back, and the morning stiffness freeze, melting away little by little. After the spine has been softened by those gentle wave-like movements. The next step in the Japanese-style morning activation is hip circles, a simple movement with the power to transform the way you walk throughout the entire day. The Japanese place great importance on hip mobility because they understand that the hips are the body's central hinge. When that hinge becomes stiff, every movement, walking, turning, bending, becomes heavier, harder, and often leads to back pain or reduced balance. Start by standing tall with your feet shoulder-width apart. Keep your knees relaxed, not locked. Imagine your pelvis as a large floating circle, and your job is to gently draw that circle using your hips. Move your hips to the right, forward, left, then back, creating a smooth, soft, even circle. Go slow. What matters most is feeling the hips gradually open up, not forcing them to move wider than they want to. Many older adults are surprised that just a few circles can create a warm, loosening sensation deep inside the hip joint. This is the moment when the joint fluid, thickened after hours of lying still, begins to thin again, allowing the joint surfaces to glide more smoothly. That's why this movement reduces the clicking sensation in the hips and makes walking feel easier. But the benefits go even deeper. Hip circles activate the gluteus medius, the deep hip rotators, and the muscles surrounding the pelvis, the very muscles that help you stay balanced when standing on one leg, climbing stairs, or changing direction while walking. When these muscles become weak or asleep, the lower back is forced to take on extra load, leading to the very common lower back pain experienced after age 60. This is also why many people feel their back become noticeably lighter after just a few days of doing hip circles. If you feel unsteady or your circles aren't smooth, don't worry. That simply means your deep pelvic muscles are still weak. You can place one hand on a chair or lightly lean on a table for support during the first week or two. As those muscles wake up, your circles will naturally feel smoother and more effortless. Perform 10 to 15 circles clockwise. Then switch direction. Move slowly, breathe steadily, and pay attention to whether each circle becomes smoother than the last. When you finish, you'll feel warmth, softness, and a sense of oiled ease in the hips. This movement doesn't just unlock the hip joint, it improves your gait, lengthens your stride, and reduces pressure on the lower back. Exactly what almost everyone over 60 is looking for. After waking up your ankles, activating your shoulder blades, softening your spine, and restoring mobility to your hips, we arrive at the final movement, and the most important one in the entire Japanese morning activation sequence: posture transition training, Seiza Kaiser transitioning. This is more than an exercise. It's the way the Japanese train their ability to stand up and sit down, a life-preserving skill that helps older adults remain independent and prevents dangerous falls. Research shows that one of the strongest predictors of fall risk is difficulty transitioning between positions, sitting to standing, bending to upright, or rising from a low position. The issue isn't weak muscles, it's loss of movement control. The body no longer knows how to distribute weight, keep the knee-hip-shoulder alignment stable, or activate the right muscles at the right time. This is why this movement focuses on slowness, control, and awareness in every phase. Start by sitting on the edge of a bed, a low chair, or a padded mat. From an upright sitting position, place one foot in front while the other leg gently drops down until the knee touches the floor. Don't rush to stand up. The goal here is to retrain your body to shift its center of gravity correctly. Lean your torso forward slightly. Feel your foot making firm contact with the ground. Notice your knee lining up with your toes. When your glutes and deep core begin to engage, slowly lift your body halfway up, not fully standing, then lower yourself back down with control. If the earlier movements were about waking up the system, this exercise is like testing and recalibrating the body's steering mechanism. It forces the brain to coordinate the hips, glutes, quadriceps, knee stabilizers, and deep core muscles with precision. When done slowly, every centimeter up and down becomes a chance for the nervous system to relearn safe, stable movement. Interestingly, in Japan, physical therapists describe this as the most effective fall prevention exercise for older adults. In the study mentioned earlier, this single movement alone reduced fall risk by 43% in just 8 weeks, an incredibly rare result for one exercise. If you feel knee discomfort, adjust by placing a soft towel under the knee or reducing the range of motion. If you struggle with balance, lightly hold onto a chair or wall for support. The goal is not repetition, it's slow, steady, conscious movement using the correct muscles. Practice for just 1 to 2 minutes each morning, and you'll notice a transformation. Standing up feels easier, sitting down feels more controlled, and that moment of hesitation or losing your footing during position changes begins to disappear. This is the true power of Seiza Kaiser transitioning, helping you maintain independence, confidence, and safety in every movement you make throughout the day. When you complete all 5 Japanese-style morning activation movements, your body enters the day in a stronger, more flexible, and more awake state. Lubricated ankles make your steps stable. Open shoulder blades help you breathe deeper. A softened spine reduces morning stiffness. Flexible hips make your walk lighter. And the posture transition exercise gives you better control when standing up and sitting down. Together, these benefits create a powerful ripple effect, reducing fall risk, easing daily aches, improving balance, and strengthening your independence in everyday life. Just a few minutes each morning, yet the impact lasts all day, helping you feel confident, steady, and energized at any age.